Do you have pain on the side of your hip? Pain that keeps you from lying on your side and makes it hard for you to sleep at night? Has your doctor diagnosed you with trochanteritis? Very well. In this video, I'm going to show you a routine of 6 exercises that will specifically help you relieve that pain and sleep better at night. Trochanteritis is actually called trochanteric bursitis and refers to the bursa. It's a fatty sac located exactly on the side of the hip, between the muscle and the hip. Its purpose is to allow more sliding between both structures. Sometimes due to aging, tissue degeneration, excessive effort, or a weak gluteus medius, this can occur. That bursa becomes inflamed, causing the symptoms that you already know very well, very well. A mat and also a small strap. We're here now. I had forgotten the strap. I have it here with me. Let's lie down on our backs. And we begin. These exercises are specially designed to relieve pain, relax all the lateral muscles, the tensor fasciae latae, and all the muscles of the gluteus medius. So your hip feels freer and you have less pain. So it's especially recommended for people who have a lot of pain before going to bed, and I suggest you do it right before you go to sleep. Place a small pillow at your cervical area for added comfort. And we start with this strap, but you don't need to have the same one. You can use a blanket, you can use a long towel, anything you can hook onto your foot. Halfway through the routine, we start with the first exercise. Pay close attention. I lie on my back, the right leg, left leg. I keep the right leg straight, the left one. I'm not going to bring it so much toward my chest, but slightly outward, as if I wanted to move it toward a point outside my knee. Watch this camera closely. I don't want to keep it against my chest because things happen quickly here. I'm not necessarily going to feel any tightness or limitation in my groin, but I want to move it slightly outward as much as possible. From here, I'm going to hold the position for 30 seconds and make a small rocking motion. Squeeze, relax, squeeze. The goal is to relax all those gluteal muscles that also attach to the femur and that can play a role in the development of trochanteritis. Squeeze, relax. We're at 15. Let's hold for another 15 seconds with that small rocking motion. 20, 20. 25. And 30. Very good. Support with your left leg. Continue with your right leg. I'm going to switch. Hug that knee toward your chest, move that knee outward, slightly outside your shoulder, and hold it there for 30 seconds. I can do a little rocking motion or hold the position steady, squeeze and relax, squeeze. Relax, squeeze, relax. We're at 10 seconds. We're going to feel it, especially here, at the glute level, at the hamstring level. A very pleasant exercise which has no contraindications, no discomfort for our hip. Next, we bring both legs up to the chest, really close together, and again, I don't want you to bring your legs here. They shouldn't be together, but rather slightly apart. Better switch the camera, slightly apart and not together. What do I want you to do now? Extend your index fingers and draw circles. Look, a big circle down and up, a big circle down and up. Let's change the view. Pay close attention. A big circle down and up. What are we doing with this? Mobilize the hip joint again, relax the flexors, stretch the extensors, and notice how my index fingers are drawing the biggest possible circle. I've done 5, let's do 10, 6, 7, 8, 9, last repetition, and once we reach 10, we do 10 again on the opposite side. Knees well apart. We don't want them together, we want them to stay apart, and the circles should be made from the hips and the lower back. 5, we're going to switch cameras again, 6, 7, 8, 9, and 10, we stop. Let's leave the left leg on the floor and place the right leg over the left leg, like this. As if it were completely crossed, so that the ankle is on the opposite thigh. From here you can use your strap, you can use your towel, your blanket, whatever you have. And from here we're going to bring the left knee toward the chest, which will make our right hip stretch. We're going to feel a great stretch, especially here at the level of the external hip rotators. Bringing the knee closer to the chest increases tension. The strap works fine. If you're younger and can reach comfortably, you can also grab this knee from underneath. Watch closely. I place one hand on each side, switch the camera, then bring my hands forward and pull. The goal is to apply maximum tension here. Don't hold back. Push your legs well toward your chest and achieve that much desired stretch. You can hold for 30 seconds or do a little rocking as we've seen before. Relaxed, rhythmic, 30 seconds enjoying the sensations. We've done 10. 20. If you can't go that far, well, that's okay. You can also work on it lower down. It all depends on how flexible you are. At the level of your right hip. Okay, a little more. And 30. We lower the foot, place it on the floor. Next, we're going to leave the strap here. We're going to let our body fall completely to the left side until the left foot touches the floor from here without moving too much. Okay? I don't want you to change position too much so that this stays within the parameters we want so that we keep tension in the hip. I want your right hand to grab that knee and your left hand to bring that foot up. Okay? The foot should be resting comfortably in a relaxed way. And from here, I'm going to push my right knee toward my left shoulder as if I wanted to bring them closer together. I push and relax. We switch cameras again. I push and relax. Tension the outer edge of the leg again. We focus a lot here on the gluteal area, a stretch that should provide a lot of relief and be very helpful for trochanteritis. Support, relax. We're going to do 10. Okay, 10 times that body bend. Support, bring the knee toward the shoulder. Relax. Support. Relax. Support. Relax. Support. Relax. Support. How many do I have? I think you have 6. 6. Relax. Let's go for 4 more. 7. 8. Very good, really. Great relief. On the side of the leg, I push. 9. Some of you can't reach this position. It's hard for you to grab your foot. Well, if you're here, you can still do it. You really can do it anyway. It's just that there will be less lateral tension. There will be less tension. I suggest bringing your foot closer and resting it on the floor. If not, just leave it and try. The rest is similar. Okay, it's not the best, but it's always better to do something than to do absolutely nothing. Next, I'm going to move back a little bit, and we're going to stretch the leg completely, the one on top. Notice my left knee is already on the floor. Now I want my right arm to be the main focus, especially my right elbow. I want you to pay attention to it and try to move it back to touch the floor. Place your hand at the level of your abdomen. Will you take a breath with me? We rotate, move our head along, and try to bring that elbow down. Notice that it's a very subtle movement, so subtle that your knee shouldn't lift off the floor. We release and make a very small, very subtle turn. Inhale, exhale, rotation at the lumbar level. We'll do 5 instead of 3 to keep it brief. We release. 4, we take a breath. We release. And 5, we go back to using this magnificent elastic band that we had set aside. We're going to switch cameras so you don't get bored watching the video, and we're going to attach it at foot level. This is like throwing a lasso at a horse. You have to try several times until that lasso, that blanket, gets to where you want it. Once it's down, well, we hook that foot. What I want is for it to be practically right here under the support, the metatarsals. Can you see it there? Yes, right? I'll bring it closer to you. Rest that leg on the floor. I'll step back so you can see. What I want here is simply to stretch the leg completely. Okay, I want that knee to be completely straight and at the same time pull the strap toward me. This depends on your flexibility. I'm not very flexible, so this already feels like a stretch for me. Others can lift their leg higher and feel less of a stretch. The aim is to feel the stretch more on the side of your leg than the back while maintaining slight tension. That's all. The knee can't bend, because as soon as it bends, you completely lose that tension. Watch closely. I'll switch the camera so you can see. My knee is fully straight here. You can't see it perfectly, but look, my foot is hooked, okay? And the higher I go, the more tension I feel. Find a spot where you feel comfortable with the tension. Let's bend this and hold it for 30 seconds, and here again we can play with that rocking motion. I pull a little, the tension increases. I relax, I pull a little, the tension increases. I relax, I pull, I relax. How long do we keep up this tug of war? 30 seconds. I pull, I relax. I pull, I relax. We've already done 15. I pull again, relax. I pull again, relax. Come on, a couple more. You can just count to 10 if you want, or count to 30. You can really do whatever you want. I take off the strap and lie on my back again. We have one last stretch left, which is similar to the one we just did, but on our back. But do you feel it already? Notice the differences we're going to find between the right hip and the left. I feel my right one is much looser, much more relaxed, and that's even though I don't have trochanteritis. Very good. We put the strap back on, which you could have actually left there during the whole exercise. And now, what I want is for you to lie on your back, place your leg at about 45 degrees and rotate it as much as possible. Previously, we were more on our side in this position. And the trick here is with this arm, the right arm. Look, I rest it on the floor. I don't bring it with the leg. No, we've already done that. The right arm rests on the floor with its shoulder and doesn't lift off at any important moment. From there, I hold the position again, feeling a tightness on the outer side of the leg. Here it's going to be a bit harder to do that rocking motion, so just count to 30. Let's count together. Stretching the tensor fasciae latae, also the hamstring muscles. Very, very pleasant. Well, pleasant, no, effective, but not very pleasant. We're at 10. A bit of silence, 20. Let's breathe. And at 30, we return to the starting position. Now yes, this is one of the stretches I like the most. Wow, what a difference in sensations at the hip level, right? Let's repeat the same thing on both sides because, just look, it's very common, very normal to find that the trochanteritis on the right side also appears on the left side. But before continuing, let me check the live stream settings perfectly. I'm going to turn my head to the other side. There we go, and we continue. Okay, earlier I already did an exercise with the left leg that I shouldn't have done. Maybe you noticed that I made a mistake. And it was the exercise of bringing the knee toward the chest. Let's do it again, but more quickly, okay? Let's bring that knee toward the chest. Remember that you don't have to keep it so close to the chest itself, but you have to move it slightly outward, okay? This allows you to make a wider movement with your hip. Look closely, I'll show you from here. This would be toward the chest and this is outward. See the difference in mobility? Amazing, right? Tightness, part of the hamstring and glute, greater mobility and flexion. We hold there for 10 seconds as a reminder since we've already done it. I really like this exercise. Next, let's repeat the one we've done before, doing 5 on each side, okay? I bring it in that way, I bring it into the right, finger always pointing up, index finger, as if we wanted to draw a big circle. 4, 5, 4, 5. Now let's do the other side again. 6. Very good also for any kind of lower back pain. 3, 4, 3, 4, 4 rolling, okay? And 5. We place our feet on the floor, cross the left leg over the right, and pay close attention. We're going to use my hands. This way. Okay, one inside, another outside, or the strap, whatever you prefer, underneath and between the legs. And from here, 3. I want to bring my right thigh up to use it as a lever arm to create tension right here at the level of the left glute. I'm going to position myself a bit more like this, otherwise I'll be out of the camera. And from here, a little tension, back and forth as far as you can, because even in the starting position, you already feel discomfort, and it's already stretching you quite a bit. Well, then stay there. You don't have to go as hard as I do, okay? What's important are your sensations, more than the instructions of the exercise. We're going to do 30 seconds. We've done 10. 20. And 30. We place our legs on the floor, remove this strap from here, we'll use it later, and we're going to rotate completely. Okay, to the right completely, so that our left foot is resting on the floor. Remember, we already saw it on the other side? From here we can do two things, okay? If you have enough flexibility, bring that foot a little closer so it's well supported and not just halfway there. Look, here it's practically straight. You can see it very, very well. In this one, let's put it down, and if you don't have enough flexibility, you can leave it halfway there. All right, it's absolutely fine. The goal of the exercise is for you to bring your right knee toward your left shoulder from here, to shorten that distance with my left hand. I'm going to do it low, 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 low. I feel tightness here in the glute area, also at the insertion of the fascia lata. Hold for a few seconds. I don't know which camera is better, that one on the side or the one in front, because both have a great view of the exercise. Tension, relax. I'm going to do 5, one with that camera over there and another 5 with this camera. 4, let's go for the 5th, push. This hand makes sure the foot doesn't slip, and this hand makes sure the exercise is done correctly. We have 5 left. Relax, let's go again. Relax again. Very pleasant. Relax. Also, anything that involves hip stretching, hip mobility will help a lot with any kind of lower back pain. Last repetition and relax. Wow, incredible, right? Next, we let the knee drop to the floor. Remember that knee doesn't separate. We're going to do a lumbar level movement, a rotation. I want you to see this fork that's moving. Place your hands at chest level, then move to one side where you have less rotation. See, on this side I can't go further. Keep both hands at chest level. I breathe in and out, move my left elbow back, but have 0 rotation here compared to the other side. I don't know if you're noticing, we inhale, exhale. I'm going to take this off because it's bothering me. Inhale. Without lifting this knee, okay? And let's move that elbow back, but by rotating the body, okay? No, it's not this, it's not doing this, but we're trying to rotate our torso. 3, come on, we have 2 left. 4, last repetition. And 5. Magnificent exercise. We take our strap, we're going to throw the loop to that foot that's down without moving too much so we don't lose our parameters. We put that elastic foot in, remember, at the level of the metatarsals. And from here I'm going to lean back a little bit because I can't be seen. That's it from here. We want to find from this position, without moving, that there's tension in the back and side area of the hip. We don't want to leave the knee bent since that loses tension, so stretch your leg and lift it as high as you can. Some might be comfortable here, but I'm not. It should be a bit lower, and from here we'll work with the strap and your foot. Keep your knee fully stretched. That's my best advice. We'll pull and hold the tension, then relax for 1 count, repeating for 10 or 30 seconds. I already forgot which. 2, let's go again. 3, from time to time push that knee, okay, because it tends to bend out of habit. Let's go again. 4, let's go again. 5 more left. It may seem like there's not much tension here, but I assure you I'm struggling. 6, 7, 3, last 4. 8, 9, last rep. And 10. Incredible. Let's relax that hip. We can rest here for a bit, but we still have one that's a little more difficult left. Same principle, place the foot at the girth for support. At the level of the metatarsals, we lie on our back, and from here we look for a different exercise, a greater challenge, hip tension. Before, we were fully on our side aiming for maximum rotation. Now the hip is bent instead. We're looking for your left hand, the secret, resting on the floor with your left shoulder and your knee fully straightened. And from here you move sideways as far as you can, no more. You'll notice tension in your own hip on the side, and from there we can play again with the tension. It's tough since you won't have much strength with one hand, so just try to hold this uncomfortable position for 30 seconds. 5, 10, left shoulder and hand pressed in, 20, knee fully stretched, 29 and 30. Slowly, very slowly, we return to the starting position, place your foot down and breathe. How are your hips feeling? Much better than before, right? The feeling of relaxation is much more effective during the routine. We've only done one set of each exercise. If you feel comfortable and want to tackle your Trochanteritis or Bursitis a bit more intensely, you can do 2 or 3 sets and adjust the length as you like. I suggest doing it on both sides for better results. Before I say goodbye, you already know we're organizing Hip Week, April 21st to 27th. You can sign up through the first comment or the link in the video description. It's an event that only takes place once a year, and I strongly encourage you not to miss it. I hope you enjoyed the exercises, that you were able to do them with me at home, and most importantly, that you can share them with people who need them. This way, making physical therapy accessible to everyone. Bye, friends.